Prostate cancer. Hello, I'm Albert Lowe. I'll talk about prostate cancer. Slide 2. Prostate cancer is the second most common cause of cancer death in men, after lung cancer. For 2013 in the US, there were close to 250,000 new cases and close to 30,000 deaths. Slide 3. What is the prostate? It is part of a man's reproductive system, about the size of a walnut, weigh about 10 grams, located in front of the rectum and under the bladder. The prostate surrounds the urethra, where the urine flows through. The prostate is an exocrine gland. It makes part of a seminal fluid to help carry sperm out of the man's body. Slide 4. How do you know you may have prostate problems? It is easy to remember. Prostate problems are no fun. F-U-N. Frequency, urgency, and nocturia related to urination needs. The next slide has a more detailed summary. Slide 5. Like if you have frequent urination, especially at night, difficulty in starting urination, or is weak or interrupt the flow of urine, pain or burning sensation during urination, difficulty in emptying the bladder completely, blood in the urine or semen, pain in the back, hips, or pelvis that doesn't go away, and painful ejaculation. Prostate disorders can be grouped into 3 types. The first one is prostatitis. When the prostate has inflammation, it presses on the urethra and affects the urine flow and causes pain. Slide 7. The second type of prostate disorder is benign prostatic hyperplasia. The prostate has abnormal cell growth, what we usually call tumor. And in this case, the benign tumor is very flat to life. The abnormal growth also presses on the urethra and affects the urine flow and causes pain. Slide 8. The third type of prostate disorder is prostate cancer, the malignant tumor. It is abnormal cell growth that from small growth stage 1 to extend outside to nearby organs and other parts of the body at stage 4. The tumor can be removed but sometimes grow back, and it can be a threat to life. Slide 9. Here's an image of the prostate gland lined with cancer cells. Slide 10. When you have symptoms of prostate disorders and go to see a doctor, the doctor would likely to use a gloved finger to perform a DRE, digital rectal exam, to feel for the abnormal bumps or hot spots. If there appears to be something abnormal, the doctor may suggest a blood test on PSA levels. PSA stands for prostate specific antigen. A higher PSA level increases the chance of having prostate cancer. Slide 12. If a DRE or PSA test suggests a problem, the doctor may recommend a biopsy. A needle is inserted through the rectum wall to collect tissue samples for analysis. A biopsy is the best way to detect cancer and predict whether it is slow growing or aggressive. Slide 13. When a person is diagnosed with cancer, typically one would start regular treatments without too much delay. But for prostate cancer, one treatment option is just monitoring, no actual treatment. Either you are diagnosed with early stage prostate cancer that seems to be growing slowly, or if you are older or have other health problems, your doctor may suggest active surveillance. Active surveillance is putting off treatment until test results show that your prostate cancer is growing or changing. Slide 14. For other actual treatment options, there are the typical surgery for easy access, localized cancer growth, and radiation therapy, again for localized growth and where the surgery may not be easily accessible. And then the chemotherapy for more advanced growth that's spread out. Hormone therapy, they try to control the sex hormone level to inhibit cancer growth. Immunotherapy, you use vaccine to stimulate the immune system to kill cancer cells. Additional comments will be made by other members of a Men's Health team. Slide 15. Who is more likely to get prostate cancer? Can one manage the risks and possibly prevent the disease? Let's first look at the risk factors. Age. Prostate cancer is rare in men younger than 40. Almost 2 out of 3 prostate cancers are found in men over 65. On race, ethnicity, prostate cancer occurs more often in African American and less in Asian American and Hispanic Latino men. On nationality, prostate cancer is most common in North America, Northwestern Europe, Australia, and on Caribbean islands. It is less common in Asia, Africa, Central America, and South America. The reasons for this are not clear. More intensive screening in some developed countries probably accounts for at least part of this difference. But other factors such as cultural, lifestyle differences are likely to be important as well. For example, men of Asian descent living in the U.S. have a lower risk of prostate cancer than white Americans, but the risk is higher than that of men of similar backgrounds living in Asia. On family history, having a father or brother with prostate cancer more than doubles a man's risk of developing this disease. On diet, men who eat a lot of red meat or high-fat dairy products appears to have a slightly higher chance of getting prostate cancer. Study also suggests that men who consume a lot of calcium through food or supplements may have a higher risk of getting the prostate cancer. On body weight, studies have found that men who are overweight may have a higher risk of prostate cancer that are likely to be fatal. Can one manage these risks and possibly prevent the disease? Unfortunately, the exact cause of prostate cancer is not known at this time, so it is not possible to prevent most cases of prostate cancer. And many risk factors, such as age, race, and family history, cannot be controlled. The things that you can do is to watch your diet, watch your weight, and do exercise. Diet high in fish and vegetables such as tomatoes, cabbage, broccoli, and cauliflower may help lower the risk of prostate cancer, especially more advanced cancer types. It may also be good to limit the amount of calcium intake and try to keep your weight within a normal range. And finally, do exercises. Studies have found that men who get regular physical activity have a slightly lower risk of prostate cancer. Rigorous activity may have a greater effect, especially on the risk of advanced prostate cancer. Slide 16. Here are the main references for information on prostate cancer. Thank you for your attention.